Alright, so abdominal angiography, clinical indications for this is going to be an aneurysm, congenital abnormalities, a GI bleed, stenosis or occlusion, and then trauma. PA projection with a digital system. So this is set up where you can do PA or lateral. Um, so just depending on what kind of system that you have, um, if you're going to have a dual system, double system, or a single C-arm. So abdominal angiograph, you can see the abdominal aorta. So aortography, angiographic study of the aorta. Vena cavography demonstrates the superior and or inferior vena cava, requires a femoral puncture. So that's when they're going to go in the femoral vein and go up through that vein. Selective angiographic studies, celiac, if they're looking at the celiac, renal, SM, IMA arteries, artery examination. So several different things that they can do depending on what is necessary. So abdominal angiography, selective renal angiogram, DSA, so digital subtraction. So this gives you the the veins of the kidney. You can see how they're dispersed in there, and then with that digital subtraction, you're not seeing as much of the bone or the tissue of the bone of the spine or the tissue of the kidney, but you're seeing more of the veins and if there's occlusions or if there's something going on. So lower abdominal angiogram, DSA image over here. So this is digital subtraction, and then this is your regular image. So you can see more of the spine, the dark tissue that lies underneath it. This one you're seeing all of the veins. It's better visualized, so you can see more of what is going on. So a lower abdominal angiogram with digital subtraction. Peripheral angiography, examination of upper or lower limbs following injection of contrast medium. So peripheral, your upper and lower extremities. Clinical indications, arthrosclerotic disease, vessel occlusion, stenosis, trauma, neoplasm, embolus, and or thrombosis. Any of those can occur within your upper limbs and lower limbs. So here we have a picture of a hand. It says left hand with digital subtraction. So you're seeing definitely the veins of the fingers. You can see something going on here, possibly here. And that's why they'll do that, just to be able to better visualize those veins. So digital subtraction can be your friend if used correctly. Lower limb arteriography, so the entire lower limbs, and then lower limb spot images, so you're just spotting at the pelvis, at the knee, and then down by the ankle. This is a complete lower limb, so this is basically the three images, either the three images fused together or just an exam that's going to visualize from top to bottom, stitching those images together. So interventional imaging procedures is a radiologic procedure that provides treatment for disease. So benefits is less invasive. Even though there is some invasiveness, it is less invasive than traditional medical surgical procedures, less expensive than traditional medical surgery procedures, a shorter hospital stay, a shorter recovery time, and it's also an alternative for non-surgical candidates. So if you happen to be a patient, or the patient happens to be somebody that cannot or won't benefit from surgery but will benefit from an interventional imaging procedure, that's when they're going to use this. So embolization procedure, so creates an embolus in vessel to control bleeding, reduce blood flow to a tumor, or treat an aneurysm. So angiogram with digital subtraction prior to the embolism, so or the embolization. So you have you're seeing this blown up here, and it's before the embolization. So now after the embolization, you don't have that dark spot there. You've actually treated the emboli, and everything should be back to normal, hopefully. So percutaneous transluminal angiography and stent placement. So they're going in, they're going to place a stent here. They're going to expand that stent, open that up, and you can see that this one here is opened up. So they basically went where it was obstructed. They inserted the deflated balloon, then they blow up the balloon, push out the lumen, and this hopefully will stay free flowing for as long as possible. So they remove the balloon and the artery is left unoccluded. Okay. So there are balloon expanding stents. So you have a stent here that is on top of this balloon. You have different sizes of stents. Stents will open up to bigger sizes. So this one here is longer. So this is for, say, something that needs to extend farther down. It's going to go in. They're going to blow up the balloon. The stent's going to expand, and then they can retract that balloon. Sometimes that stent will stay in there. Sometimes they'll pull that stent back out, just depending on what they're needing to do with it. So just like this here, you can see that this aneurysm, they put the stent in so it bypasses this aneurysm, keeps this from ballooning up more, keeps it from collecting blood and then possibly rupturing. So it kind of basically takes the blood past that weak aneurysm and then transports it down where it needs to go. So stent graft for abdominal aortic aneurysm, so a triple A. Inferior vena cava filter, you can see right here with the arrows, they're showing you where that filter is, and you can see that filter right in here. So an IVC filter, inferior vena cava filter, and then radiograph of an IVC filter in place, and you can see, so they're showing you right here and right here. It's some radio opaque particles in there or makeup of that filter, so it can be visualized on a radiograph. Venous access devices, so ultrasound guidance for line placement. They'll use ultrasound a lot of times to find the vein that they're going to access. After they access it, then they're done with ultrasound. But ultrasound is a good device to use to make sure that you get the correct vein, that you're not getting an artery, so not the common carotid artery, but the internal jugular vein, if that's what you're shooting for. So it just helps guide you along your way, helps eliminate mistakes. So venous access devices, a central venous catheter. These are placed in the OR. Patient is put under. A lot of times you'll have C-arm just to verify placement. This is a power port, so they'll place these, and once again as well, like I said, sometimes you'll have C-arm to verify placement, and then always a chest x-ray. And then a hemodialysis catheter. Usually these are placed, and then a chest x-ray is taken to make sure that they are in place. Sometimes they can be put in under fluoro or C-arm in the OR room. Sometimes they do go to the cath lab, just depending on how busy it is, how backed up it is. So transjugular, intrahepatic, portosystemic shunt, so TIPS. So when you see TIPS, you know that it's the transjugular intrahepatic portosystemic shunt. Creates artificial passageway for portal venous circulation. So portal venous circulation, it's to treat variceal bleeding, so bleeding in your liver, refractory ascites, advanced cirrhosis, and end-stage liver disease. So any of these conditions, you will have a TIPS procedure. Thrombolysis, so interventional procedure to dissolve blood clot. Pulse spray and infusion catheter. So an infusion catheter is going to be put in, and you can see the drips here. So that's the medicine that's infusing into the blood system to destroy and break up the thrombosis, the blood clot. And then the pulse spray is here, so it's a little bit more aggressive, but they'll spray that, and then that should dissolve that blood clot, because you don't want that blood clot traveling. So extraction of vascular foreign bodies, retrieval instruments, so a grasping forceps, they can take this in, they can grasp that blood clot, pull it back out if they need to, or with a retrieval basket, they can do that as well. That basket will open up around it, and then they'll close it in and bring it back out with it. So if they're going to retrieve anything, that's what they're going to normally use, is the grasping forceps or the retrieval basket. So a vertebroplasty, percutaneous injection of acrylic cement into a vertebral body for stabilization and pain relief. So this is a vertebroplasty of T10. So you can see that this cement is in here, and it's going to be visualized from here on out on an x-ray, on a CT. So this is a CT demonstrating cement deposit throughout the vertebral body. So right here, you're seeing that. And it's just, if your vertebral body collapses or gets crushed, they can go in there and do a vertebroplasty and decrease pain and stabilize your vertebral column. So here, a balloon inserted into the collapsed vertebrae. So you can see that the vertebrae is collapsed. They're going to go in, they'll usually have to drill a hole. They can insert a balloon, expand that balloon, and it will bring that vertebral body back into position where it is. And then a lot of times they can fill that cavity now with cement. But for a kyphoplasty, the balloon is inserted into the collapsed vertebrae to restore collapsed vertebral body before cement injection. So they will insert cement into there to keep that expanded and to keep it from pinching and crushing even more. So enteric stenting, stent placement to relieve a bowel obstruction. So you've got your guide wire and your stent, your endoscope there. So 2 days later, some opening of stricture. So you can see the stent right here, and it's opening that stricture and allowing for more movement within that enteric system, so within that bowel. Sometimes those stents have to stay. Sometimes they can remove later on, just depending on what the initial diagnosis was. So nephrostomy, they're going to insert stents. Stents can run from kidney to bladder. They can run from kidney to the outside of the body to a collection bag, just depending on what needs to be done. Usually if they're going to run to the outside of the body, they run to the back, since the kidney's set in that retroperitoneal space. So they'll go in from the back into the kidney, and then that stent will be into a collection device that the patient can change on their own. So catheter inserted into the renal pelvis, drainage catheter, and urethral stents, just depending on what they're going to use. So percutaneous biliary drainage, so PBD, internal or external drainage. So once again, this can either drain internal or external depending on what they're needing to do. They will remove stones, dilation of an obstructed bile duct, and then also a palliative procedure, reduction of pain, reduction of pressure, just depending on what is necessary and what they're going to do. So percutaneous abdominal abscess drainage, PAD. You can see the large abscess here. This is on a CT image. And then after the abscess drainage, the tube is still in place. You can see the tube here. It's still in place and going to remain in place until they feel like the drainage is good enough and they can remove it, and then that will go ahead and heal. Other non-vascular interventional procedures, needle aspiration, so to drain an abscess, percutaneous needle biopsy, so a tissue sample for assessment, and then percutaneous gastrostomy, extended feeding, or gastric compression. So if you need a feeding tube, or if they need to release pressure within the stomach, they can do that as well with that percutaneous gastrostomy. So we're going to do some quiz-mes here. So CO2 can be used for selected angiographic procedures when the use of iodinated contrast agent is contraindicated. So make sure that you look at this within the book, see about CO2 and angiographic procedures. So the answer to this is true. CO2 can be used. So the next quiz-me. The imaging sequence during a cerebral angiogram to visualize all phases of circulation are arterial, capillary, and venous is typically what? 1 to 3, 5 to 7, 8 to 10, or 12 to 15. So go back and look in that book to see what those phases of circulation are. And the answer is 1 to 3 seconds. You will get circulation, arterial, capillary, and venous. So 1 to 3 seconds is typical. Catheterization during vena cavaography requires a puncture of the what? The femoral artery, the femoral vein, inferior vena cava, or the hepatic portal vein. And we know that it is the femoral vein for the vena cavaography. So CT has largely replaced lymphography. So is this true or false? And this is true. So CT is taking over some of that lymphography. A procedure performed to chemically dissolve a blood clot is termed. So remember when we had the drip infusion or the spray, and we're trying to dissolve those blood clots? Is it infusion therapy? Is it embolization? Is it thrombolysis? Or is it heparinization? And we know the answer is C, thrombolysis. So which procedure involves placing a balloon into a collapsed vertebral body? So this is that balloon into that vertebral body. Vertebroplasty, kyphoplasty, spondyloplasty, or vertebral stenting. And we know that that is kyphoplasty. So there's a lot in this section. Make sure that you kind of break it out and chunk it so you know what's going on and the different procedures. If you have any questions, please reach out to me and let me know. And more videos to come.